ধন্যবাদ সবাইকে। শুভ সন্ধ্যা। আমরা আবারও গত সপ্তাহের মতো এবারও আমরা সবাই এক হয়েছি। বিশেষ করে হচ্ছে আমাদের ফিজিও নিউজ 24 এর পেজ থেকে সবাইকে সুস্বাগতম। আজকেও অন্য বারের মতো ব্যতিক্রম নয়, আজকেও আমরা নতুন একটা বিষয় নিয়ে আপনাদের সামনে হাজির হয়েছি। তো আজকে আমাদের সামনে একজন বিশেষ বিখ্যাত ব্যক্তিকে আমাদের সাথে পেয়েছি। আমাদের সাথে আজকে আছেন আর ডক্টর রমন কাপুর স্যার, এবং সুদূর ইন্ডিয়া থেকে উনি এসেছেন, এবং উনি খুব বিশেষ খ্যাতিমান একজন লোক, কারণ 2008 সালে উনি পদ্মশ্রী পুরস্কারে ভূষিত হয়েছেন। এটা ইন্ডিয়ার সর্বোচ্চ আহ রাষ্ট্রপতি পদক। তো তৎকালীন 2008 সালে তৎকালীন রাষ্ট্রপতি প্রতিভা পাটেল ছিলেন, এবং তার হাত থেকে উনি পুরস্কার পেয়েছিলেন। তো আমরা আসলেই খুবই গর্বিত। আর বিশেষ করে স্যারের সাথে আমাদের এই সুযোগ করে দেওয়ার জন্য আমি ডক্টর উমাশঙ্কর মহন্তি স্যারকেও ধন্যবাদ জানাচ্ছি। তার কারণেই আসলে আমরা স্যারকে পেয়েছি। এবং আজকের টপিকসটা হচ্ছে আকুপাঞ্চারের উপরে, এবং আমরা সবাই জানি এটা একটা বিশেষ চিকিৎসা পদ্ধতি, এবং সুদূর ইন্ডিয়াতেও প্রথম দিককার সময়ে স্যারের হাত ধরেই আকুপাঞ্চার ইন্ডিয়াতে খুব জনপ্রিয়তা লাভ করে। এবং উনি কিন্তু একজন এমবিবিএস ডক্টর, এবং তার পাশাপাশি উনি আকুপাঞ্চারটা উনি শুধু চীন এবং বিভিন্ন দেশ থেকে শিখে এসছেন। তো চলুন আমরা চলে যাই আসলে ইংরেজিতে, কারণ আমাদের সাথে পৃথিবীর বিভিন্ন দেশের মানুষ সবসময় যুক্ত হন। তো তাদের সুবিধার্থে আসলে আমরা একটু ইংরেজিতে চলে যাব। So welcome everybody, and this is a today is our also a special day, because today we have got one of the uh, great member in this subcontinent. Especially, he is a very well-known person from the beginning, and he is Dr. Raman Kapoor sir. And we have got this such a man, that is, he has got the Padrasri Bhushan. Padrasri Padak is called very famous. He's a president honored, and I think as very few people have got that. So he has got on 2008 from Pratibha Patel. That time she was the prime minister, that is a president of Indian government. So we hope, and Star has some beautiful background. So I will go directly on that before hand over to you, sir. That is Dr. Raman Kapoor. He has completed his MBBS. Yes, sir. Thank you, sir. So I have to give some introduction about it. That is, he has completed his MBBS from UCMS in 1973, and I think it's very far from, like, at that time I wasn't in the world. And also he has completed his residency at Safdarjung Hospital in Delhi, and after that he has completed some enthusiastic topics like acupuncture from China, and also from another part of the world, and in 1982, and that was my birth year. So I think it's a great pleasure for us. That is, we have got such a honored and respected person. Like always, I'm shared. That is, we learn from past. We not learn from future. We just predict future, but by seeing the past, we are continue our present. So such a senior person we have, and I would like to thank Dr. Umashankar Mohanty sir. Is my mentors in manual therapy, and by his grace and by his link, I have found such a man from our side. And thank you, sir, for giving us a time. And I think next 1 hour will be the great session for us, and I hope so. That is, it's a very few word I have introduced, but you have a lot of background. Like you have wrote 3 books on acupuncture also, and also you have presented a lot of research paper and your presentation all over the India. So I think it's a great pleasure for our country, especially from Bangladesh. But I think we have a lot of people from outsider like Sri Lanka and subcontinent and SAARC countries, and also outside the SAARC countries. So I would like to everybody with most warm welcome today's session. I think sir will be going to rock. And thank you, sir.
Thank
And this is time for you. Thank you, sir.
you.
Yeah, it's over to you, sir. Yes.
A very good evening to everybody from all over the world, whosoever are listening to this lovely telecast today on the Facebook. And all thanks to Shantanu and their team who have made all the efforts and invited me today. And I would like to give you a brief introduction about acupuncture, about how acupuncture scientifically works, and why the physicians and the physiotherapists alike should learn acupuncture, and how it can greatly benefit in promoting their practice as well as in creating great results for their patients and also improve on their practice. So we will start with our presentation straight away.
Yes.
Uh, yeah. So what is so my topic would be on learning acupuncture to relieve pain effectively, because this is one area where most of the physiotherapists are working. And I will also be touching upon other areas where acupuncture has been found to be very effective as a modality of treatment. So the presentation today would be on what is acupuncture, what are the conditions for which acupuncture is recommended, how acupuncture works in relieving pain, how acupuncture works in post-stroke rehabilitation, which is another big area of work for our physiotherapist colleagues. What is the status of physiotherapists practicing acupuncture? How can you learn acupuncture? Then I'll give you a small get up on how you would diagnose and treat a low back pain patient with acupuncture. How will you treat a post-stroke patient with scalp acupuncture, which is a very specialized technique in acupuncture. A word about newer techniques, which includes kinetic acupuncture. What are the adjuvants which are used in acupuncture practice? And what are the PubMed studies available on the role of acupuncture in pain and rehab? So acupuncture is formed with two words, acus and puncture, where acus means needle and puncture means to penetrate. So there are nearly 800 acupuncture points which have been identified, and there are nearly 12 primary channels which have been identified in our body, along which these points are located. These 12 channels are the primary channels. Then we also have the front and back midline channel, and then we also have the extraordinary points also. Because as the science has progressed, so also has research progressed, and newer points have also been identified. In addition to that, we also have specially located points in the scalp, which are known as scalp acupuncture points. Then there are points in the hands and feet, and there is a very specialized area of treatment which is known as ear acupuncture, in which we have got points located in the ear. The NIH and the WHO acknowledges acupuncture, and it has been scientifically accepted as a modality of treatment by the WHO many years ago. And this is a list of conditions which WHO recommends wherein acupuncture should be used as a first line of treatment, which includes, as you can see the list, right from addictions to anxiety to arthritis to asthma to the ones in the dark are the ones wherein our colleagues who are physicians and physiotherapists would be keen on learning: carpal tunnel syndrome, chronic fatigue syndromes, and then fibromyalgias, then low back pain, osteoarthritis, then sciatica, lumbar disc problems, shoulder pains, including frozen shoulders, tennis elbows. Uh, these are the conditions wherein acupuncture has been officially recognized by WHO to work very effectively. Now, how acupuncture helps in relieving pain? This is a very interesting question, which everybody must be having in your mind. So, it uncovers the root cause of pain. So, what is the root cause of pain? We need to reach there, because unless we treat the root, even if you treat the branch, the patient will get back the pain again and again. So, that is the biggest advantage of acupuncture. So, it focuses upon correcting the problem and strengthening the body. It unblocks the body's internal flow of healing energies. It also facilitates the free flow of healing energies throughout the meridian networks. It reduces inflammation. It expedites the healing process, and it alleviates pain. Now, the ancient view of pain, if you can see in the figure on your right hand side, is we talk of something known as chi or qi, which is the energy which travels through our meridian system, and it is this energy which provides nourishment to every cell, tissue, muscle, gland, and organ in our body. And when this energy becomes blocked and imbalanced, pain and disease results. So as you can see, water is flowing through river networks, which nourishes our planet. So same way, this energy is flowing through our body, through meridian networks, which nourishes our body. Now, whenever this energy flow gets blocked, we develop an area of pain. So if you see in the figure on your screen, you can see that the energy is flowing from different energy channels, from the lung to the large intestine, to the stomach, to the spleen, to the heart, to the small intestine, to the bladder, kidney pericardium, and then gallbladder, liver, and so there is a continuous flow of energy through these 12 energy channels. And in each of these energy channels, there is a peak energy flow for 2 hours per day. So in a 24-hour cycle, every channel has a peak energy flow for 2 hours. Now, what is the mechanism of action? How does acupuncture cause pain relief? So a lot of scientific research work has been done, and the mechanism of action has been now crystallized into 3 levels of theories. One is the neurological theory, the other is the hormonal theory, and the third is the psychological theory. In the neurological theory, there are 3 areas where we can show the work of acupuncture to work. One is through the great control theory of pain, the other is the descending system of pain suppression, and the viscerosomatic reflex, which are all responsible for the analgesic effects, and the antidrome reflex, which is responsible for the motor recovery. Now, the neuromodulation of pain, as all of you are very well aware of, happens at 4 levels in our body: at the peripheral level, at the spinal segmental level, at the supraspinal level, and at the cortical level. Now, at the peripheral level, it happens by the reduction of chemicals which are responsible for the action potential. It also happens by the application of heat, like we apply shortwave diathermies, hot packs, other modalities like ultrasonics, and acupuncture. At the spinal segmental level, it works by the physiological blocking effects and by the segmental inhibition or the gate control theory. So acupuncture works at the spinal segmental level also through the gate control theory of pain. And at the supraspinal level, it is through the placebo effect and the counter irritant effect. So at the supraspinal level also, acupuncture has been found to play a role. At the cortical level, it also works by behavior modification and through the psychological effects. So what is the mechanism of neuromodulation which is relevant to acupuncture? So the physiological blocking effects happen through electro acupuncture, wherein we use high frequency currents which applied through the acupuncture needle reduces the conduction velocity. At the spinal segmental level, which I'll discuss further, it is explained through the great control theory of pain. So here comes the segmental inhibition, which is the gate control theory, wherein we all know very well that there are the large fibers and the small fibers. Now, what happens is that when we put a needle, we actually stimulate the small nerve fibers. So before the signal of pain is able to reach the gate, and the gate only allows one type of signals to go through it, the putting of a needle at an acupuncture point and just rotating it elicits a response in our body, and as a result of which the small nerve fibers get stimulated and they enter through the gate, as a result of which the actual pain uh, is not felt by the patient, and as a result of that the patient is able to feel the pain relief. There is also the descending system of pain suppression, which we all know, which works through the periaqueductal gray matter, the rostral ventral medulla, and the spinal dorsal horn. And here also acupuncture works. The hormonal theory, which is also very famous, the neurohumoral mechanism is involved in that, wherein acupuncture has been scientifically proven to stimulate the release of endorphins, the substance P, the 5-hydroxytryptamine, acetylcholine, the dopamine, the noradrenaline in the cerebrum. What is the therapeutic mechanism of acupuncture? So, if you see in this picture, it shows you an entire mechanism of how acupuncture would work. And if I was to summarize this picture in the next slide, it is very simple that when we insert a needle, it provokes an acute defensive inflammatory response. And the afferent pain neurons distribute to the dorsal horn of the spinal cord, and this in turn triggers the gamma loop efferents in the ventral horn and activates the neurons that crisscross over the spinal cord to the brain, and then it disactivates the somatic motor nerves, and from here to the muscles and autonomic motor nerves to the peripheral blood vessels, and then to the internal organs. Second, that was the pain. Now, how acupuncture helps in post-stroke rehabilitation. Acupuncture has been described as increasing the pain threshold through needle activation of the pain receptors, which I explained to you, by sending signals to the central nervous system to release the opioid peptides. The analgesia, which is achieved through acupuncture, may relax the muscles, allowing for a passive motion and increase range of motion and ultimately motor impairment rehabilitation. Another observed physiological effect of acupuncture is the increased perfusion within the peri-infarcts and the low perfusion zones in the affected lobe, as observed in fMRIs of post-stroke patients receiving acupuncture. This possible effect could play a role in modifying tissue perfusion within cerebral areas affected by stroke, thus promoting a more rapid and effective recovery. It has also been suggested that adaptive changes in response to stroke involve neuronal reorganization and increased dendritic volume in the cortical layers and number of synapses in the contralateral hemisphere within 30 days after a central nervous system injury. And acupuncture may also offer benefit in this reorganization process by stimulating the peripheral site of the lesions. Now, what is the worldwide status of physiotherapists practicing acupuncture? Because I was told by Dr. Shantanu that there's a large number of physiotherapists who would be watching this webinar today. So I thought, let me make them aware of the worldwide status of the physiotherapists who are practicing acupuncture today. The current state of acupuncture in India, as per the Ministry of Health and Family Welfare orders, and you will be happy to know that I've been involved in each step forward with the Government of India. The 2003 order, first order for the Ministry of Health, allowed acupuncture to be qualified as a mode of therapy, which was at that time allowed only to be practiced by registered practitioners. That means the allopathy graduates and the Ayush graduates, which include the Ayurveda, yoga naturopathy, the Siddha and the homeopathy graduates to only practice acupuncture. Subsequent to that, I received a lot of requests as president of the Society of Medical Acupuncture from dentists and physiotherapists, telling me that look, since worldwide dentists and physiotherapists are also allowed to legally practice acupuncture, they should also be allowed. So I did presentations before the central government ministry. And in 2014, the first order, which was an addition to the 2003 order only, they added the inclusion of acupuncture practices by registered dental practitioners for treatment of pain in their domain is justified and is recommended. So in 2014 onwards, acupuncture is also allowed in India to be practiced by dentists in the domain of pain. Then the 2016 order was a very significant order, because in that order, physiotherapists were also allowed to be permitted to practice acupuncture in India, along with the Ayush and allopathy and dental graduates. And subsequent to that, we have been working now to get acupuncture recognized as an independent system of healthcare in India. And you'll be glad to know that again, I am the vice chairman of the expert committee formed by the government of India. And in 2019, an order was passed by the government of India in which it clearly stated that acupuncture has now been accepted as an independent system of healthcare for the indications for which there is evidence and expertise exists for teaching, training, and certification. And we are quite actively involved with the ministry. And the final Apex committee, which was formed to go into the entire course curriculum to be formulated for the same, has already been done. And in July of this year, the entire report has been already submitted to the government of India. And very soon, we should have a proper council for regulation of acupuncture. And we will also start diploma and degree courses in acupuncture after class 12 in India. Now, as far as the Charter of Physiotherapists in UK is concerned, the British Medical Acupuncture Society is the professional body for doctors and healthcare professionals, including dentists and physiotherapists, who use acupuncture in their practice. So chartered physiotherapists can also train as practitioners and become members of the Acupuncture Association of Chartered Physiotherapists. And they have to complete 240 hours of a course before he or she can register with the AACP, which is the Authorized Association of Chartered Physiotherapists. And this organization was founded over 20 years ago and has grown steadily to become the organization it is today. Then acupuncture is working for elite athletes. So athletes are also turning to acupuncture to help improve performances without the use of drugs and with few or no side effects. I have had a good chance of treating a lot of my own cricketers, including Yuvraj Singh, who had many problems with injuries during his career of cricket, and we were able to help him out greatly with acupuncture. So is one of the skills which is employed within physiotherapy as part of an integrated approach to treat pain and inflammation. And there is also a journal of the Acupuncture Association of Chartered Physiotherapists where they publish systematic reviews, literature reviews, clinical papers, opinion piece, case studies, surveys, and audits are also done. And regular features include book, products, and research reviews and conference reports. The Physiotherapy Association of New Zealand is a special interest group in New Zealand, and that also offers postgraduate diploma in physiotherapy acupuncture, which includes a biomedical science and physiotherapy in semester 1, and introduction to musculoskeletal acupuncture in semester 2, then orthopedic manipulative therapy in semester 1, which also includes the advanced study of clinical theory, and the theoretical construction clinical practice in semester 2 aims to evaluate the physiotherapy clinical practice and also evaluate management of patients and to contribute to development of effective and efficacious physiotherapy managements. The Australian Acupuncture Physio Association, also evidence-based for acupuncture in various areas of physiotherapy, has substantially increased over the past decade, and in particular research has grown to provide evidence-based support in treatment of acute and chronic low back pain, chronic neck pain, tension-type migraine headaches, pelvic girdle pain, even chronic hip joint pains, knee osteoarthritis, lateral elbow pain, and shoulder conditions, including frozen shoulders. The Canadian Physiotherapy Association also has a vision to promote acupuncture and encourages an actively engaged membership which is committed to lifelong learning and excellence in order to promote health and well-being amongst their patients. And there also you can learn acupuncture. The South African Society of Physiotherapy also promotes acupuncture in the physiotherapy group, and Acupuncture has become a part of South African physiotherapy practice since 1983, after several physiotherapists took their initial acupuncture training under Dr. George Lewitt in England. These eminent doctors had undertaken extensive training in the subject in mainland China, and during their visit to South Africa, changed the thinking of a considerable number of health professionals, which include medical doctors, homeopaths, and physiotherapists. And you also have the South African Society of Physiotherapists, which was formed in 86, and they have a special interest group in 1990, which it formed, and this effectively recognized acupuncture as being within the scope of physiotherapy. Same, the South African Society of Physiotherapy, and these are just a few examples of physiotherapists' major use of acupuncture. This system of treatment also has benefits and is used in the physiotherapeutic management of neurological conditions like hemiplegias, spinal injuries, respiratory conditions, chronic bronchitis also, tobacco and peripheral neuropathy, alcohol dependency, stress-related conditions. So these are the many areas in which acupuncture also can be used. Now, what are the WHO guidelines for doctors to practice acupuncture? Now, acupuncture and physiotherapy. Now, we all know acupuncture is a system of medicine which uses needles to stimulate certain points in the body to treat various diseases. And Harvard offers a 300-hour program to doctors and physiotherapists to train them in acupuncture related to their respective specialized field. As per WHO, these are the bare minimum requirement for Western medicine training that needs to be imparted to an acupuncture. And this source is from the WHO guidelines on the basic training and safety for acupuncture. So by the end of the course, the student should have a sound understanding of the essentials of anatomy, an understanding of the principles of hygiene, common forms of disease and ill health in community, proficiency in making a simple but competent examination of the patient, and at arriving at a tentative diagnosis, and then the ability to decide whether a patient may safely and suitably be treated by acupuncture or he should be referred to a healthcare professional. Then WHO also defines the basic safety precautions like a clean work environment, clean hands, preparation of needling site using alcohol, use of disposable needles, aseptic technique, and insertion of needles without touching the needle shaft. And physiotherapists meet the basic requirements in terms of Western medical training as well as their ability to maintain the safety requirements. Hence, they should be allowed to practice acupuncture if they have the required training in acupuncture. Now, what are the acupuncture courses being offered in India? And this is where we have been quite active. Me and my wife, Dr. Sunita, have been promoting acupuncture in India in a big way. And for the last over 15 years, Dr. Sunita has been training doctors from all fields, right from homeopathy to Ayurveda, to physiotherapy, to dentists, to gynecologists, to physicians, to orthopedic surgeons who come to learn acupuncture from her and then utilize that knowledge in their respective fields to great results. The acupuncture course which is offered in India is offered through our institute, which is the Institute of Acupuncture and Natural Medicine. It offers a certificate of training course in acupuncture, which has got 1500 hours to 1200 hours. 80 hours are of the online theory component, 120 hours is of a classroom theory, and another 100 hours is of classroom practical. Now, we have divided the entire online theory into 5 sub-courses. The course A is on the basic theories, course B is on the diagnostics, course C is on acupuncture and moxibustion, the basic theory, and the acupuncture and moxibustion treatment is in course D, and course E offers the scalp and ear acupuncture, which are specialized techniques, and then you have contact sessions 1, 2, 3, and 4. Now, looking at the needs of people from outside India who have also started coming to us for learning acupuncture for the last few years, we decided that the contact sessions 1, 2, 3, and 4 could also be converted into learning modules wherein we could teach the entire hands-on training also through these modules, so that a person who's probably sitting in Bangladesh also could do these contact sessions of the hands-on practice through video lecturing, and also do the needling techniques also through video lecturing on their patients. So because of the COVID situation, we decided to go for these. Otherwise, we were having 4 modules of the training. If you can see, this is just a basic content course of what we are going to teach you and what you are going to learn during the course curriculum. This is quite a detailed curriculum. If Shantanu would want me, I could share the file with him, which would be able to let a lot of our uh, colleagues who are listening to this telecast today, this webinar today, to be able to know what exactly will be the learning contents. Then in the contact session, we basically do 6 hours of contact sessions per day for 10 days at a stretch. And this is normally done over a period of 10 days. So after every 3 months, the doctor is called for 10 days to our practice, and he works with us for 10 days at a stretch. And there he is able to do all the practical learning of how to do needling, how to do treatments on different conditions, different patients, and how to diagnose a disease. And there are 4 such contact sessions in a year, which is done after every 3 months. So in all, there are 40 days of hands-on training in a year, and 6 hours per session comes to about 240 hours, which is as exactly as per WHO guidelines for the hands-on training. Now I come to trying to explain to you how exactly we would like to define 2 common problems which probably each one of you would be facing in your practice, and how the acupuncture views it and how we treat it. So first of all, condition which I would like to share with you is back pain, because all of us know very well that this is one of the commonest conditions which a physiotherapist or even a physician sees in his practice. So acupuncture views back pain as a bisyndrome. And what is a bisyndrome? Bisyndrome is a condition which is caused by obstruction of the flow of chi and blood. What is chi? Chi is nothing but energy. So whenever there is an obstruction of flow of energy, we get pain. Or whenever there is a sluggishness or slowing down of the flow of energy and blood, we can get pain. Then another factor which can also cause acute pain to happen is because of invasion of external pathogenic factors, like, for example, wind. Suppose you get exposed to coldness or to dampness or to heat. That also can trigger a back pain. So you have to diagnose the pain with acupuncture. So what are the characteristics of pain? One is the typical B syndrome will be pain. Along with that, patients can also complain of numbness. Sometimes they will complain of heaviness in the limb. They can also have swelling in the limb. They can have soreness. They can also have aching or throbbing feeling in the area affected. Now, the traditional methods of the causes of back pain were environmental, which can also influence our health, like exposure to wind, exposure to dampness, coldness, phlegm, stasis, or trauma. And how do we diagnose a patient with pain? So if a patient has got a wind type of pain, this pain is classified as a wandering pain, which is something which you must always have seen in your practice, wherein patients have shifting pain. The pain moves from joint to joint. And an example of this wind type of pain is rheumatoid arthritis. Then the damp type of pain. This is classified as a fixed pain, and this is caused by invasion of dampness. And this gets worse during a damp weather. This pain does not radiate. It is localized to one area, and this is accompanied with the swelling of the joints and muscles and feeling of heaviness. And an example of this type of pain is osteoarthritis and gouty arthritis. Then a cold type of pain. This is classified as an aching pain, and this is caused by invasion of cold, and this is usually fixed in location. It may be worse at night and can get better during the day, and the patient has severe joint or muscle pain with a limited range of movement, and an example of this type of pain is ankylosing spondylitis. Then a heat type of pain, wherein the area which is painful is quite hot and inflamed, and this can be caused by an underlying weakness in the body. This can be a radiating pain. Patient has throbbing in the area. There is a redness and swelling in the joints, and the pain is quite severe. And this also limits the range of movement. And an example of this type of pain is an acute exacerbation of a rheumatoid arthritis or a gouty arthritis pain. Then a phlegm type of pain. This is a pain which is classified as a very deep joint pain, and it can be caused when any of the previous four types of pain linger. That means lingering pain, which is a chronic pain. And this can also lead to muscle atrophy and weakness, and also swelling and deformity of joints. And an example of this type of pain is an advanced stage of arthritis. Then we also have a condition which is known as stasis type of pain, which is classified as a stagnant pain. That means patient says that the pain is static at one location. It's a stabbing sensation of pain, and this example of this type of pain would be an advanced stage of arthritis and a traumatic or a muscle sprain or a strain. Then how do you treat such patients with pain? So if you know the cause of pain is coldness, suppose a patient has been traveling in a climate which is very cold, and after exposure to sudden coldness, he has got this pain. So you will use warming methods. If the patient has been exposed to damp atmosphere or damp weather, then you will use dryness and dampness elimination methods. And if the patient's diagnosis is heat, that means exposure to heat has caused the pain, then you use cooling methods to get relief from the pain. And how do you choose the most effective acupuncture points? So local points are the points which are normally chosen to treat. Then you also have distal acupuncture points, and these are the newer theories now which are used in acupuncture treatment, which are known as Tung and Tan style of acupuncture. Then you also use ear acupuncture points, which is known as auricular acupuncture. And then you also have super specialized type of points in the scalp, which are known as scalp acupuncture points. And scalp acupuncture also and ear acupuncture also are taught as a part of our curriculum in acupuncture. In addition to that, you can also use some adjunct therapies, and I will also talk to you about that also to make you aware of what are the adjunct therapies which you use in acupuncture. And then you also determine a treatment schedule as per the patient's duration of illness. Now, what are the adjunct therapies we will use with acupuncture? One is electro acupuncture, wherein a mild electrical pulse is passed through these acupuncture needles, and this electrical pulse can be a continuous wave or can be a dense dispersed type of wave, which is also taught as a part of your course curriculum. Then gua sha therapy is wherein you do a scraping type of a therapy where an oil is massaged over the acupuncture points. Then tuina is a massage again, and this is generally used in children who will not accept needles. Then you also do cupping therapy, wherein there are many different types of cups. You can use bamboo cups, you can use glass cups, you can use plastic cups. And then a very specialized technique is what is known as Moxibustion. Moxa is a herb, which is basically nothing else but Artemisia vulgaris, and this is a herb with which is packed into a roll form. The roll form can be burnt over the acupuncture point, or it can also be cut into small pieces and placed over the handle of the acupuncture needles and burned. And this gives a very mild heat at the acupuncture point. And also infrared heat lamp, which is also known as a TDP lamp, which is a common practice now, and it is present in all my treatment rooms where I treat my patients with acupuncture, which is also useful in particularly in patients who have got a stagnant type of pain or in patients who have got pain due to uh, coldness. I talked to you about scalp acupuncture. This is a picture of the scalp acupuncture areas, which also you'll be learning when you do this basic course. And this is showing the various zones where we needle. The motor zone is used for treating the motor problems, wherein the patient has got muscle loss, and the sensory zone is used for treating sensory problems like numbness. And we also have the speech zones for treating patients who have post hemiplegic speech issues. Then we also have the vertigo auditory zones, and you also have the chorea tremor control areas, which is used to treat patients with Parkinsonism. So there's a very big range of treat diseases which can be treated very effectively with acupuncture. Kinetic acupuncture. This is something new, which I also learned about a few years ago, and we also would like to share with our physiotherapist friends as well as our physician friends who are listening to the webinar as to what is kinetic acupuncture. Kinetic acupuncture is based on the synergism of acupuncture and conventional physiotherapy, what is kinesiotherapy. Since acupuncture improves the local blood circulations and also causes muscle relaxation and relieves pain. So kinetic acupuncture is carried out in 3 phases: the pre-kinetic, the kinetic, and the post-kinetic. In the pre-kinetic phase, the needles are inserted in systemic acupuncture point or the body acupuncture points, or in the microsystemic points like the scalp acupuncture points, the ear acupuncture points, or the hand acupuncture points, or the foot acupuncture points. It aims to prepare the musculoskeletal system and to facilitate the response to physiotherapy by interrupting the pain cycle. In the kinetic phase, the microacupuncture system is maintained while selecting group exercises of physiotherapy which were performed simultaneously. It also aims to promote synergism to restore mobility. Simultaneous use of scalp acupuncture with exercises improved motor function during the treatment of hemiplegia. In the post-kinetic phase, you can place mustard seeds on the ear acupuncture point, which are greatly sensitive, just after physiotherapy, and this can help in maintaining acupuncture stimulation for hours to weeks. In the place of mustard seeds, you can also sometimes use very fine ear acupuncture needles. So kinetic acupuncture is effective and may have a worthwhile role to play in the treatment of chronic conditions and in rehabilitation in order to improve the pain intensity, to improve the functional mobility, and to also improve the performance in daily activities. What are the adjuncts in acupuncture? The first adjunct which I talk to you is electro acupuncture. So what is electro acupuncture? This is a technique which applies small electrical currents to needles that have been specifically inserted at specific acupuncture points. What is the mechanism of electroacupuncture? Electroacupuncture induces and recovering the profile of acupuncture analgesia involvement of hormonal factor. We've already talked about this has been supported by cross perfusion experiments in which acupuncture induced analgesic effect was transferred from the donor rabbit to the recipient rabbit when the CSF was antiserum against the endorphins, which suggests that endorphins are involved. More recent research found the release of endorphins into the CSF following electroacupuncture. Low frequency, that means 2 Hz, and high frequency, 100 Hz of electroacupuncture selectively induces the release of enkephalins and dynorphins in both experimental animals and humans. That means when you use low frequency stimulation, you stimulate the release of enkephalins, and we use high frequency stimulation, you stimulate the release of dynorphins. And clinical studies suggesting the effectiveness for the treatment of various types of pain, anxiety, depression, spinally induced muscle spasms, stroke, GI disorders, and drug addictions are plenty available on the PubMed. Now, electroacupuncture and chronic pain. So, electroacupuncture is useful in addition to MA when patients are not responding well to normal acupuncture. So, due to multifactorial nature of chronic pain, it needs to be a multidisciplinary treatment. Short-term pain relief could be achieved from 50 to 70% of the patients. Long-term results are not promising. In such patients, clinical research of poor quality of studies are available for analysis which precludes definitive conclusion. So Adrian White reviewed the clinical application of electroacupuncture and concluded that it results in long-term benefits in about 25% of chronic patients. And this form of electroacupuncture was more effective for musculoskeletal conditions and as well as for neuropathic pain. So electro acupuncture has been found to be more effective for both pain reduction and for restoration of autonomic and trophic functions in patients with chronic post-traumatic pain. And electro acupuncture has been found to be more effective in short-term pain relief also than manual acupuncture. Then electroacupuncture and myofascial pain. Myofascial pain associates with muscle shortening, and stretching is very important for any treatment. So electroacupuncture with low frequency 1 to 5 hertz and very short pulse in either continuous or interrupted mode was used, and stimulation should not be too intense, and normally we give stimulation only to the intensity which the patient can tolerate, and treatment may need not to be continued for long periods for maximum benefits. Then another very interesting area is motor point acupuncture. We've also been using motor point acupuncture in our practices, and this has also been found to be very effective. And you all must be quite aware of the muscle motor points. I'll give you a brief overlook of the few muscle motor points which we use in acupuncture practice. In the cervical area, there is an acupuncture point in the sternocleidomastoid muscle, which is known as the SI16. And this point is used, this is a motor point which is used to relieve any spasm in the sternocleidomastoid. In the levator scapulae, the motor point which is used is about 1 centimeter posterior to the small intestine 16 acupuncture point. In the upper traps, there is an acupuncture point which is known as gallbladder 21. And then in the lumbar muscle, we have also motor points which are located in the gluteus maximus and in the piriformis. Then we also have now what is very, very exciting in the development of acupuncture, because a lot of patients would come to us in our practice also who would say that they are fearful of needles, although the needle is as thin as our hair and it almost causes negligible pain, and just about maybe 10 to 12 needles are inserted in each treatment for a patient. That is the number of needles which are normally used in a treatment session. But some patients will be very apprehensive of needles, and particularly the elderly patients or small children. So lasers have been found to be very effective, and now laser acupuncture in itself is a big system which is practiced all over the world. We also have different type of lasers available with us. We have got shower lasers. We have got lasers which are used as at needle acupuncture points, which are known as laser needle acupuncture techniques. We also have lasers which are pen lasers, which can also be used at acupuncture points, and which we also have lasers in the form of a belt, which can be used for low back, wherein there are many laser lights which are fixed inside the belt and which could be used over the area of pain. So low level laser therapy, this is what is known as LLLT, is used for musculoskeletal disorders like joint pains, backache, neck pains. It can also be used for skin diseases and can also be used for cosmetic problems like acne, wrinkles, scars, dark circles under the eyes, and facelifts. So do not think that acupuncture is only limited to treatment of diseases. It is also today a great tool to learn in cosmetic problems. So you can also use it for treating cosmetic issues in your practice. Then another device which has also been recently added to our armamentarium is color puncture. So different color filters are used at acupuncture points to balance the flow of energy, and disorders which are treated by color puncture include migraine, sinusitis, uh, children who have got mild to moderate cases of cerebral palsy, and autistic children, particularly autistic children less than 7 years of age, respond very well to acupuncture. Optic nerve atrophy, irritable bowel syndrome. Then I talk to you about Moxibustion. This is a very effective tonification treatment, particularly useful in deficient disorders like patients with chronic fatigue, diarrhea, chronic joint pains, dysmenorias, and chronic asthma. Cupping therapy, I have talked to you before also about this. It is very useful in treating chronic backache, neck shoulder pains, and arthritic pain. And this involves creating vacuum by a suction pump at acupuncture points. Then sonopuncture is again another needleless acupuncture treatment in which sound waves are used at various acupuncture points, and we can use it for treating cervical spondylosis, low back, arthritis, frozen shoulders. Then gua sha therapy, or also known as scraping therapy, again very useful in treating backaches, neck pain, and a very special herbal oil is rubbed into the acupuncture meridian with a jade stone, and it is absolutely painless. Accutron is a needleless type of acupuncture treatment which utilizes milliamp and microamp current and interferential currents, and it is again very useful in musculoskeletal pains through pads. Now, I will just share with you a few PubMed studies on acupuncture. All of you are very aware today through the net. All of us can see so many studies available on acupuncture, but a few which I would like to share with you are the ones which have been done on pain management. And this was 2005 August, which showed the long-term clinical and economic benefits of offering acupuncture care to patients with chronic low back pain. And total of 159 patients were there, and 80 were in the usual arm care, and it was a randomized trial, and acupuncture care was significantly more effective in reducing body pains than usual care. Then the cost effectiveness of acupuncture for chronic non-specific low back pain, according to WHO also, cost effectiveness threshold values, acupuncture is a very cost effective treatment strategy in patients with chronic low back pain. Then efficacy and safety of acupuncture for chronic discogenic sciatica. This is a randomized trial. Again, it's a very safe treatment in treating chronic discogenic sciatica. Then acupuncture for chronic low back pain. This was a multi-center randomized sham controlled trial which was done in 2013. And this suggests acupuncture shows better effect on the reduction of both pain intensity than sham controlled patients. Then acupuncture anesthesia mediated elevation of central sensitization also has been done. Then this is a review of acupuncture for peripheral joint osteoarthritis. Then effectiveness of acupuncture and electroacupuncture for chronic neck pain. This is again a systemic review and meta-analysis. If you want, I can share these articles with you on the PubMed. Then effect of electroacupuncture merged with rehab for frozen shoulder syndrome. This is a single-blind randomized sham-controlled study. Then effectiveness of strengthened stimulation during acupuncture for treatment of Bell's palsy, again a RCT. Then in post-stroke rehabilitation also, this is a study which is a meta-analysis, and it is in the Stroke Journal which has been published. And it demonstrates that acupuncture is effective in the treatment of post-stroke rehabilitation. Thank you very much for having been a very patient audience. And now I would request Dr. Shantanu to kindly take over, and I would be very happy to answer questions, whichever they may be from the audience.
Thank you, sir. And I think it's a great time for us because we have learned a lot of new concepts and new things. And especially, I would like to give thanks to sir. That is, he have given us a scope, not only in the India, because like our country, we are a very small country, but we always try to follow India. So I think we need you like people in our country because if this type of development country like us, we have also limited resources and limited scope and limited supported people like you. Because when we are fighting, like we are fighting our fellows, callous physician. They sometimes they don't have time to give us a scope. But you have learned ancient knowledge and ancient thing. But sir, it's a very sorrowful thing that is we have to learn these techniques from China. But
No,
this is
we are
the
no more learning it from China. Now we are
but
independent and we are teaching ourselves. It was
yes
old
sir
times.
now
I went in the 80s. At that time, there was no learning platform in India and anywhere. But now we are independent enough, and that is the reason why a lot of Western universities also are today promoting acupuncture in a big way. You will be actually surprised because I have traveled the world over, and Australia, England, as a matter of fact, every state, all the 49 states in the US, has their own respective acupuncture council. So for practicing acupuncture in any state, you need to be a registered member of that state council. So it's now quite widely accepted.
yes sir. Sir, but I want to share something in ancient like this theory is not invented by China. This is the
No, no,
invention of this subcontinent, and this is the one of the news is coming from Upanishad,
you're very
not
right.
outside.
Vedic
So it
Vedic
is our
scriptures,
culture.
Vedic
This is our
scriptures.
culture.
You're
Yes,
right. Vedic scriptures mention the use of sui bhedan as a form of
yes, sir.
treatment.
Of
So
course.
you're very correct. You're very correct.
This is the invention of this is cupping therapy and this is the all kinds of. But
Yes,
after the war of
yes,
Kurukshetra,
yes,
then the Pal were came in this war, the subcontinents to rule, and these are Buddhist, and they stolen this type of theories from
you are
here.
correct. Yes.
So
A lot
this
of
all
literature
theory,
was stolen by Chinese and then they
yes,
developed. But at the end of the day,
they
any system which is a healing system should be used for mankind,
sure, sir,
for the
sure,
relief.
sir.
So we
But
are doing
we
at
are
the moment.
very, but
Yeah,
we
at
are
the moment,
sorry, we are sorry for the new generation that we don't know, but this is our old culture. This is
correct,
born from this air.
correct.
And also I proud to say that is all over the world they came here to rule us, but we never
Yes,
go there
yes,
because
correct.
we have the heaven, we have the power, we have the knowledge, and we have the manure mart, so we can cultivate everything very
You are very correct.
very sharp brain, but it is the lack of I think facilities, but lack of emotion or lack of try. That's why we are behind, far
Yes,
more behind than England, Canada. But this is the origin. If you believe in Darwin theory, that also after South Africa or Africa, then this human mankind are developed in this subcontinent. So we
correct.
are proud, but I think it's need time to understand. And
Eh, As a matter of fact, I developed the department of acupuncture in one of the leading hospitals in Delhi. And
yes,
I am the chairman of the Department of Medical Acupuncture at Sir Gangaram Hospital, which is a 750 bed hospital in Delhi. And I am running this department for last 22 years. And now we have got a team of 4 doctors, which is in the department with me. And we also not only treat outdoor patients, we also are called in to treat indoor patients. And we have been, I must feel proud in saying that we have been able to revive a few of the patients out of coma also with acupuncture. So this is something which is amazing. So the area of work is very large. As a matter of fact, we are now doing a study at the hospital in improving the immunity of patients with acupuncture in COVID cases. So this study is in to improve the immunity. One in patients who have not had COVID and who are prone because of their low immunity, to improve the immunity, and by biochemical tests, by showing the level of IL-2 and interleukin-7, and by showing the improvement in lymphocyte counts pre-acupuncture and post-acupuncture. So it's a very scientific study,
yes,
and we are doing randomized trial study. And number two, you will also be happy to know that in addition to this, we are also treating a lot of post-COVID complications which are now coming up, which is cough, which is not getting better even after the patient has turned negative of COVID, and that also is getting treated very effectively with acupuncture. Chronic fatigue, which a lot of people are developing after COVID. Third is the problem of COPD, chronic obstructive pulmonary disease, where also acupuncture is being useful. And fourth is for patients who have a lot of stress, because a lot of the patients who have gone through COVID, they develop the problem of anxiety, insomnia, and fear of maybe having a relapse. And five and last most important symptom after post-COVID is digestive problems. So we are treating all such type of patients also. In the last 3 to 4 months, you will be happy to know that we have had almost about 5 to 10 patients of all these different types with which acupuncture has been given, and they have shown very good response. I am
That's
very
great.
lucky because I am working in a Western hospital, which is an allopath dominated hospital, and I am also an allopath. So I have a very good coordination with my Western colleagues, and they also refer patients to me where they find they are unable to do anything much. So it's a good way of working together.
Yes, sir, that's true, sir. And we have, I have learned something about the dry needle. So it's similar kind of acupuncture technique, but maybe little bit more specific. Like I heard or I learned something like nowadays FDA approved rather than painkiller, you can use acupuncture because this one prick can increase 4 neurotransmitter at a time. That will be the inhibitory rather than only PG prostaglandin synthesis after giving this painkiller.
And
So
then
I
most
think
painkillers are very addicting also.
yes,
And over a period of time, a lot of patients who come to us have been on painkillers for a long time. And so we need to actually make them withdraw the painkillers gradually. And particularly for patients who are on chronic nerve root pains and all, sciatica and all, who have been on GABA pain and all, it becomes quite a difficult situation because once they withdraw the medication, their pain again goes up. So a combination of judicially used acupuncture is very, very useful in making these patients gradually taper off the medicines. I recently had a very interesting patient from the US who got stuck in India because of the COVID and couldn't go back. And she had the most severe of neck shoulder pains, and she used to take marijuana to get relieved. And marijuana is not allowed in India. It is not legalized, although it is an over the counter available in US. But and she couldn't survive because she took all the routine painkillers and no response. So somebody who was my patient brought her to me, and you'll be surprised in just about 15-20 treatment sessions, she is free of pain, and she's surprised that she's been able to leave addiction problem of marijuana without any big problems at all.
so that time you have used any electrical stimulation also with
Uh, Electro acupuncture we do use, but I think if you actually learn the method of needling properly, you do not require electro acupuncture in all patients. Only in patients where we find the patient is not responding to only needle acupuncture or manual acupuncture, we should use electro acupuncture. But
so
then again,
for,
it's a very safe and easy method.
so for this withdrawal syndrome, you are using the central conceptual line for that.
For withdrawal symptoms, ear acupuncture is the best way because inside the ear there are over 80 acupuncture points, 80, and they are placed very near to each other. So we utilize a special probe to exactly locate these points, and then on those points we use micro needles, which are less than half an inch in size. And we also use retention needles like mustard seeds, which can be left in place because they go on working 24/7. And that helps in the withdrawal. Because the most important thing to remember is in alcohol or any drug abuse situation, it is the withdrawal symptom which is the problem for patients. So
Yes.
the acupuncture makes the withdrawal very, very comfortable and very safe.
So I think any nowadays maybe it will more research will come, and uh, especially the expert will go more on systemic approaches, like through this skin or through the invasive technique, they can
We
treat the
did a very
side.
interesting study in Delhi. This is known as the Fmri study, which I did at my hospital only, wherein uh, uh, about 5 6 years back, the functional MRI machine was installed for the first time in a hospital in Delhi. So it came to my mind that why should we not check for our Western colleagues to show that when we put a needle at a particular acupuncture point, that actually produces a signal in the brain. So what we did was, it was very simple. We took a patient who had a nerve deafness problem, put him inside the functional MRI machine, and checked his area of hearing in the functional area of the hearing. And we found that there was very low activity in the hearing area. Then we brought this patient out of the machine and we put few acupuncture points at remote points. So it is not necessary in acupuncture to needle only at the point which is causing the problem. Like for example, if a patient has an ear problem, does not mean you have to needle around the ear. You can in the hand and the foot also and get a response for the hearing. So the specific acupuncture points which were designated in the hands and legs were needled, and they were connected to electro acupuncture stimulator and taped so that the needles don't come out when the patient goes back into the MRI machine. And lo and behold, uh, all the doctors who were in the team of the MRI team, radiologists, were surprised that immediately the area of the scalp area of hearing started showing increased activity. So we repeated the same thing in a patient with optic nerve atrophy, wherein we needled the scalp at the vision area, which is at the back of the head. And this also we did it once before, where putting needles, wherein the patient was having optic nerve atrophy and he had low vision, and we found that there was absolutely little or no activity in the vision area. And after we put the acupuncture needles and connected it to an electro acupuncture stimulator and put this patient back into the fMRI machine, there was an increase in visual activity in the vision area. So these all prove to us scientifically that it is not any humbug, it is proper science which is working through a scientific method. And that is why one of the reasons why acupuncture today has such a very large following in the Western world also, because of the scientific trials and clinical studies available. As a matter of fact, recently WHO published a paper on the way to go forward in health, WHO strategies from 2020 to 24, next 4 years, the plan of action. So in that study, they showed that next to allopathy, the system which is most accepted worldwide by patients is acupuncture. Even I was surprised to note. So, which means that more and more people, and particularly the qualified people like you people who are already there in practicing, should learn this science, because this can only help you in promoting your practice. Because I know dry needling has its benefit, but then it limits your knowledge base, and you can use it only in a few limited conditions. Whereas acupuncture, you can utilize in so many conditions, and with your knowledge base you can treat it in almost all types of conditions which you can think about in your practice today.
Thank you. So I think all participants will be attentive, because Dr. Shamim will now share the link for feedback, and after fill up your feedback form, you can instantly get the certificate through your email. So if it is like a pending, like when more than 100 people are engaging on the just single link, then Google will be more. I think there will be traffic jam during the net. So then it will take time to get your certificate instantly. So please try again and again. Every time that we have seen that is some people they are not able to get the certificate in just automatically due to that jam. So I think very soon Dr. Shamim is going to share that link now. So I think you can easily access your certificate. And sir, there is not more any question. I think the participants are very clear about that. So one of our participants asked about what is the basic difference, is there is any difference between acupuncture and dry needling?
Yeah, there is a lot of difference, because in dry needling we are not going as per the acupuncture meridians. We are not going through a pathway, whereas in acupuncture we are going through a specific nerve pathway, and the points of acupuncture are located along specific pathways. So when we are actually needling at a point, we are triggering a response from in the body, and there is a specific body stimulus which is produced, and that is how the actual pain relief starts happening through the central nervous system. So acupuncture is, that is the reason why dry needling cannot be used in a, say for example, in a condition like hemiplegia, wherein dry needling will have no role to play. Whereas in hemiplegia, we have got acupuncture points, wherein we can also use electro acupuncture for muscle building, for improving the strength of the muscle, and for rehabilitation programs also we can use electro acupuncture. So it is much beyond dry needling, and it is a much more scientific method, and can be used for treating a large number of diseases in addition to only pain.
So some most of the people are asking about the feedback link that we will provide soon, is feedback sheet. And also after if it is not shared now, so you can go directly to our page, which is 24 page, or that is a classroom page. So there you can get also, and also I will provide that link on our WhatsApp group. So don't worry. Sir, any other question? Sir, I have a question that is, we have some acupuncture and that scalping. All methods are surface related techniques. All are on surface. So I think it's mainly depend on the embryonic theory, like ectoderm is represent to the skin and also the central nervous system.
Yeah. So I'll explain to you. Acupuncture is not related just to the ectoderm. Cupping and gua sha therapy, these are all related at the surface level. So when you learn acupuncture, you will understand that we talk about the disease coming from the exterior and then moving into the interior. So when we suppose, as an example, I'll tell you, suppose a patient gets a COVID infection. So what is the stage one? Stage one is the pathogen enters from the exterior. So that is the best stage for treatment with acupuncture. Why? Because the pathogen is only at the exterior level, and it is much easier to make the pathogen go away from the exterior. Once the disease and your immune system is suppose poor, and suppose patients have got other comorbidities, and the disease goes inside, then gradually the disease starts affecting the organ system itself, and there is a cytokine storm. So that is the time where it becomes much more difficult for the treatment to take effect, and that is why acupuncture works through the meridian system. So initially it works from the exterior, then goes to the interior. So the disease travels from the exterior, then to the muscle level, then to the deeper tissue levels, and finally to the organ level. So we also treat, say for example, a patient with a fatty liver. Now, fatty liver would mean that the actual liver organ has got affected. So the needling process and the process of retention of needles will be different than suppose, for example, you are treating a condition wherein the disease is at the superficial level. So say, for example, a patient has a fatty liver. So your needling will be much more deeper as compared to another patient who has a disease at the superficial level. Say, for example, patient has a simple cold or an influenza. So the needling is much more superficial. You don't need to go that deep. But once the disease reaches the organ level, then the needling techniques are different and the methods of treatment are different. So everything will vary. That is why it is not a treatment which is done only at the superficial level. It is a treatment which is done at the organ level also. Say, for example, a patient of COVID, if he has got the actual lung parenchyma has got damaged, which means lung has got fibrosis. So then in that case, you are not going to treat only the lung channel. The channel is only at the superficial level, but the organ is much more deeper. So for treating the organ, you have a different protocol of acupuncture points. So that is why it is such a beautiful science. It is such an interesting science. And that is why it is so important that you have to have a proper knowledge of your anatomy, physiology, pathology, and biochemistry, everything. Because if you have that in mind, then you know what you are doing with each point which you are putting in the body.
That's also I'm going to be asked, that is how important the basic knowledge, because nowadays this subcontinent we have a lot of quackery business, and a lot of people are doing that, like in cupping, some religious person they are
Yes,
doing. So
hijama.
without a hijama, without medical knowledge, how invasive technique they are used to do
That is
regularly, I can't say, but at least medical graduate should be do that. At least
That's
not
why, that's why,
diploma
that's
or not.
why, that is why we are being very, very strict in India. So what we have done now is, and that is the reason why we are formulating some laws in India. So the initial thing was to create more qualified practitioners. And I told you the people who could learn. But now with the awareness having grown, we have decided that we need to also start the diploma and degree courses in acupuncture after class 12. But the course curriculum is quite strict, and it is quite deep, because the actual degree course is over 4,800 hours. So it's a quite extensive course, and all these the details of the course and curriculum which we have decided as a committee in India under the Ministry of Health, with very learned doctors as member of the team. They are from All Institute of Medical Sciences, Delhi. They are from CMC Ludhiana. They are from PGI Chandigarh. So they are very senior people who are working with me to finalize this course curriculum. We have again gone back to the already existing courses which are being offered by the Western universities on these systems. So from their experience, as well as from what we feel will be a great knowledge base for our people, we have made a course which will be suitable to our Indian plethora as well as the Asian plethora, and also help in the type of problems which we are facing. Recently, there was this very interesting study which is very pertinent to our area, because we have tuberculosis, which is again growing very fast, much faster than what we are talking about COVID, and the mortality is much higher than COVID
Yes.
also. But and these are endemic areas. India is one of the endemic areas for tuberculosis. So
Sir, maybe tuberculosis is the second death cause in India
yes,
and first death cause in Bangladesh.
yes. So now you'll be surprised to know that if you were to learn acupuncture, you can actually, because this is a study which has been done by a team of doctors in Africa, in the areas where TB is also endemic, and they did a very wonderful study, and this is also available on the internet, and it's a published study wherein they showed that just by using moxibustion, I talked about a Chinese herb being used at acupuncture point. So just by using moxibustion at specific acupuncture points every day, these patients of tuberculosis, their their dependency on drugs could be gradually, the withdrawal symptoms and their effect of the drug could be improved, one. And particularly in MDR cases, That means patients who have multiple drug resistance problem, we could overcome that also by combining it with Moxibustion. So the studies are very good and it doesn't cost so much. So importance is the cost factor also. And this can be taught to a healthcare worker also, because there in these type of treatment protocols, no needles are used. Only Moxibustion is used. And Moxibustion is just burning a herb over an acupuncture point. So the healthcare workers who are working in with patients who are active tubercular patients, or in populations where where the healthcare workers go to give oral medicines also to such patients, or even in India where we have got tuberculosis hospitals, they can be trained to do this Moxibustion treatment every day to such patients and improve the patient outcome. So there is so much more to do. It is much beyond the realms of what we have been thinking till now. And that is the reason why I feel there is a big dearth of qualified personnel in this field in our country as well as in Bangladesh.
Yes, sir. Thank you, sir. Sir, is there any study like we know there's for tuberculosis we need to 6 months or 9 months drug. So after giving this motivation, it reduces any doses or death or time.
See, the study which has been done is being done on MDR cases and also in patients who developed concomitant HIV infections, because tubercular patients are very prone to develop HIV. So they proved by the study that patients who took acupuncture, who took Moxibustion plus the standard tubercular medicines, they were able to prevent having HIV, or their immune system was much better. And this was also proved by biochemical tests, which was the lymphocyte counts, the total blood counts. So all these tests were also done to prove that it works scientifically. So what I'm trying to say is that we have great methods now available to prove also that these systems are working. But what is required is a bigger awareness and more workers to do this type of therapeutics.
That's good. That's good. And someone is asked that is about this video is could be online or not, or from that is Algeria. So
Yeah.
I'd like to share that is this video will be available always on our page, so you can see
Okay.
it because maybe she has some internet issue. So I think she can see it again many more times, no problem. So I think, thank you, sir. Maybe some issue is there for sending the feedback. So I would like to request all participants, please visit again. We will put that feedback link on our live chat or comment section. So you can get it in next time or few minutes or a few hours later. So when you come back and on that page, click on there, or I will share in our suitable WhatsApp group or any other group. So from there you can also get the feedback. So don't worry. And if not possible, then we'll send the your certificate through on your registration. So not a problem for that. So no question. I think, sir, your presentation is quite good because
Thank you
when
very much.
nobody asks question, then two things happen.
Yeah.
Everybody can understand or they
No,
can.
but I think
But
by and large, since most of the people are qualified people, they must have understood it. And if they still have
yes,
any questions, you can share my email with them, and
okay, sir. Sure, sir.
always write to
Sure,
me
sir.
on.
We have a group also, faculties group, and also we have a plan to expose all faculties on our web page. So individually they can share that
Sure.
their contact address, email ID, everything. So it will be possible. You can share. And sir, last of all, I want to ask you that is how we can collaborate with you for not only you like any online workshop, online courses. So how can you like this COVID situation? People are not used to go in India or any other country. We can't invite you also. So it is
Yes.
possible to conduct any classes on from online.
Why not?
Maybe
Why not?
it will be
Why
extended.
not? We can always do it. We have already developed modules now of training, and you are most welcome. As a matter of fact, there is something which is very recent, and this was something which I learnt about when I gone to Japan recently. There is a professor of neurosurgery there who has developed a new technique. He has left his neurosurgery practice, and now he practices only this form of acupuncture, where he does not use any needles, and he uses a special type of a technique which is known as PNST, peripheral nerve stimulation technique. And I have been doing webinars on that, and you can learn this technique only through a webinar also, and you don't have to come to me in Delhi for learning it. So we are planning to do a webinar on PNST therapy very soon, and if you wish, we will share the link with you, and you can ask your colleagues also who wish to learn it, can learn it online.
Yes, sir. We can your program we can share on our page also at a time.
Yes.
No problem.
Yes.
That will be also a problem. Collaborate program will be there. You can directly share your program on our page. That
Perfect.
can be possible.
That would be
So
great.
already, yes, sir. Already 1 hour and 30 minutes.
Yeah, nearly
It's a great,
1.5 hours.
great time, sir. Great
Thank you
time
very
to
much.
talk with you. Thank you,
Thank
sir.
you, Shantanu,
And
for all your efforts. Thank to our gentleman, Shamim,
yes,
for
sir.
all
He
his
is
support.
on back. And also thank you to Umashankar Mohanty, sir, because by the
Dr.
help of
Puncture
him,
was there.
we have
He
found
was
you.
there. He was there in this show. And I must thank him also for introducing me to you, and through you to so many others. And we look
Thank you, sir.
forward to future interaction.
Sure,
Thank you
sir.
very much.
Sure, sir. It's the beginning, sir. It's the
Yes.
beginning, sir.
Thank you.
Thank you. And thank you, your son, also, for
Yeah.
helping on the technical side. He is a
I
doctor also, sir.
will pass the message.
Oh,
Thank
of
you.
course, sir. Thank you, sir.
He is an
Namaste.
anesthetist. He is an MD in
Oh,
anesthesia,
oh, great, sir. Great, sir.
and now practicing acupuncture.
Okay. Yes, sir. Anesthesia, yes, is more related to pain management and also.
Yes.
Thank you,
Thank
sir.
you. Thank you.